Thank you, Kathy, and thank you for hosting this last panel of the day. And I'd like to thank the presenters of this afternoon's session. And just to recap briefly, this afternoon we've covered the integration of COVID vaccines into the routine immunization programs, some of the challenges to doing that, but also some of the benefits of doing that. And my takeaway was that we've had some important gains in the rollout of the COVID immunization program, and we don't want to lose those gains. We want to be able to move forward with some of the benefits of what that's brought to us. And I would like Dr. Penny Ballum to know that one of the benefits was development of a one-page adverse event reporting form. So we will make sure that the emergency room physicians in British Columbia are aware that they can have a much simpler process for reporting adverse events. We also understood or had explained to us the importance of considering and understanding the needs and perspectives of all members of our population, and the fact that digital information may not meet their needs, which was, I think, an important takeaway from me, because so much of our COVID vaccine rollout has been based on digital information, being able to read emails, receive text messages, and that's not going to meet all the needs. And this is important, especially for racialized communities who come from a variety of backgrounds in which they may not trust government and other organized programs like public health. We also heard about what's new and interesting. We heard about a number of resources and tools to support recipients of vaccines, healthcare providers who either provide advice or answer questions or actually deliver immunization services, as well as materials to support teachers of students in grades 4 through 12. And finally, we had a lovely presentation from Kyla about the near future landscape of pneumococcal conjugate vaccines, which is important, and an important reminder for us that we can't lose sight of our existing immunization programs and keeping abreast of the science in this area and new products that can continue to improve our disease prevention strategies that are not related to COVID. I'd like to thank everybody for participating. This has been the largest attended event. It's been virtual, but we think we've had over 500 people attend for this event. Just another reminder to please evaluate this event so that we can make improvements for next time. We do intend to have a next time, and we'll be having discussions next week. I'd like to thank very much the British Columbia Immunization Committee for funding this forum to allow us to deliver it to you. And I'd also like to thank the planning committee members, some of whom you've met because they've facilitated the sessions during yesterday morning and this afternoon, and they include Kim Bartel, Julie Benninger, Kathy Chilton, Alexis Crabtree, Mina Dower, Marian Gunther, Rebecca Haber, Emily Malnis, and Stephanie Meyer. And I'd also like to thank Daniela Michel and Marilyn McIver, who've done the bulk of the administrative heavy lifting to bring this event to you, as well as the AV services of the UBC Robson Square. I'd like to remind physicians who participated that if you'd like to get CME credits, please send an email to imsforum@bccdc.ca. Sorry, imsforum@bccdc.ca, and you'll be able to get your certificate. I'd like to thank everybody who participated in this event, including those of you who asked questions on Slido that allowed us to make this an interactive event. And despite the fact that it had to be virtual and we didn't have the opportunities for the networking that we usually have, I hope that it's been sufficiently interactive to give you value to having spent your time with us. And it's reminded me that just like it takes a village to raise a child, it takes a village to immunize a child and to immunize everybody in our community. British Columbia has a multi-provider immunization program, and everybody has a role in continuing to deliver a high-quality immunization service for vaccination to prevent disease in this province. And we support and value all providers. So thank you very much for participating. And have a good evening.